from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is Healthcast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to Healthcast. I'm Allison Gottermeyer. Thank you so much for joining us today as we discuss postpartum healthcare and postpartum depression. Our guest today is OBGYN Dr. Mallory Littman. Thank you so much for joining us.
Thank you so much for having me.
So let's start at the beginning. Baby is born, then what? What does postpartum care look like?
So postpartum care starts immediately after delivery with skin to skin. We aim to try to do that within the first hour after delivery, either in the operating room or in the delivery room, wherever your delivery takes place. Then you move to the mother-baby unit and you'll have your team of nurses, of doctors, lactation, everyone working with you to get you ready for that transition home with baby. Your first initial postpartum visit may be within the first few weeks of your delivery or may not be until 6 weeks after delivery. That postpartum period is technically that year after delivery though, but it looks different for everyone.
What should someone be prepared for at that first appointment, whether it's in those first few weeks or more likely at that 6 to 8 week mark?
So that 6 week mark, we talk about a lot of things. It's a very comprehensive visit. We talk about, check in on baby, see how your baby's doing. Talk about breastfeeding, talk about birth control, talk about sexual health. And then a lot of the time is spent talking about mood. There's a lot of changes that occur after delivery, a lot of hormone changes. So a lot of the time it's focused talking about, any mood changes that you may be experiencing.
And of course, there's that screening for postpartum depression. What is postpartum depression?
So depression in general is incredibly common. It's much more common in women than in men, and particularly in the reproductive years. Postpartum depression is depression that occurs in that postpartum period. Usually would initially start after 2 weeks after delivery, but can occur anywhere in the first 12 months. Postpartum depression, it happens because there's a lot of hormone changes that occur after delivery, particularly your estrogen and progesterone levels are declining, but a lot of other hormones are changing, your cortisol, thyroid, and it can lead to this depressive episode in the postpartum period.
You hear about baby blues versus postpartum depression. With that hormone surge, sometimes women are just a little bit more emotional. There's also the sleeplessness and everything else. How do you know if it's reached the level of actual postpartum depression?
Sure. So the baby blues are very normal. They typically peak within the first few days after a delivery, but then it should pretty much resolve after 2 weeks. If those depressive symptoms are continuing or worsening after 2 weeks, then we start worrying about postpartum depression. Postpartum depression has a lot of things or signs that might be normal in a postpartum period, like sleeplessness, being tired, fatigued, overwhelmed, sometimes feeling sad. But if your day is spent, being sad most of the time on most days, then we start worrying about postpartum depression. There's some things that are specific to the postpartum period that can occur for postpartum depression. So having trouble bonding with your baby, having difficulties with breastfeeding, being irritated by your baby, not wanting to be around baby, having troubles bonding with your partner, maybe turning to substances because of the things that you're feeling. Those would be signs of postpartum depression and not just the baby blues.
And how common is that?
It's really common. So it can be seen in between, depending where you look, 7% to 20% of women postpartum.
Who can be diagnosed with postpartum, and is anyone at higher risk of developing postpartum depression?
Sure. So anyone can be diagnosed, women and men. So as many as 5% of partners or men can be diagnosed with postpartum depression. If you had depression prior to pregnancy or during pregnancy, then you'd be at higher risk of having postpartum depression. If you had it in a prior pregnancy, if there was a stressful event that occurred during your pregnancy, during your delivery, if baby had to spend time in NICU or you had a preterm delivery, if you don't have much support at home, smoking increases the risk. So a lot of things that a lot of people experience can increase your risk.
Can it be prevented?
So some healthy lifestyle things can help prevent postpartum depression. Exercise, eating a well-balanced diet. Those are really the only few things that have been found to help prevent postpartum depression. But most importantly, it's not your fault, and so many people can be diagnosed with it.
And I think you mentioned this before, but is postpartum depression always diagnosed right after having baby?
So no, it's most often diagnosed within that 6-week period, but it can be diagnosed up to a full year after delivery.
What does treatment look like for postpartum depression?
So treatment is mostly centered around either therapy or medication. Both have been found to be equally effective. Both of them combined is the most effective, but whichever one fits best with your life and your family is what's best for you.
Why is it so important to get postpartum depression diagnosed and then treated quickly?
So if you have postpartum depression, it can affect your bonding with your baby. It can make breastfeeding difficult, and we see lower rates of breastfeeding. It can affect bonding with your partner. And then a really staggering, chilling statistic is the rates of postpartum suicide too are incredibly high, and some of the highest causes of postpartum mortality. So it's very important that we take it seriously and screen everyone for it.
So what should someone do if they think they might have postpartum depression, or if someone watching this or listening to this thinks someone they love has postpartum depression?
So talk to your OBGYN, your primary care doctor, your partner, call 911, reach out to anyone that you feel comfortable talking to. And who knows, maybe it's not postpartum depression. Maybe it's just, a few things that you're struggling with, but really, reach out to someone and talk about it because it is important to be treated if it is.
Something that's heard about maybe a little bit less is postpartum mania. Can you talk a little bit about what that is?
So postpartum mania or postpartum psychosis is very rare, fortunately. It's an emergency. So this is not necessarily a progression that postpartum depression can take, but a separate subset. And this is where you can have or develop some intrusive thoughts, hallucinations, or delusions that, your baby is bad, baby is evil, different things like that, and is a true emergency.
So we've talked about postpartum depression. We mentioned postpartum mania. Are there any other concerns that are major concerns in postpartum care, mentally or physically, that you want people to really pay attention to?
So I always tell my patients that everything should get better and better day by day. There will be ups and downs, but your mood may go up and down, but should, for the most part, start getting better. Your bleeding that you have postpartum should, slowly get better day by day. Other things, blood clots can happen in the postpartum period. That's something to look out for. Preeclampsia that we hear about a lot during pregnancy can also happen postpartum.
So what are some of those signs of postpartum preeclampsia?
So the main part of postpartum preeclampsia is high blood pressure. But some things that you could experience at home if you have high blood pressure would be things like a very bad headache that doesn't get better with Tylenol or ibuprofen, vision changes. Sometimes you might feel pain in your upper belly or the right side of your belly. And then, of course, if your blood pressure is high, that would be the main diagnostic factor.
Can it be prevented?
Unfortunately, no. It can't.
So it's not at all your fault. It has nothing to do with...
Not your fault at all. The treatment is delivery, mostly delivery of the placenta, but it can still happen in the postpartum period. So it's absolutely not your fault at all.
Parents are often so busy caring for the new baby that they forget to take care of themselves. What do you emphasize to your patients regarding postpartum care in general?
So same as in during pregnancy, you need to have a healthy mom in order to have a healthy baby. So same goes for the postpartum period. You need to have healthy parents for a healthy baby. It's okay to take time for yourself, whether it be that, couple minutes that you have to yourself or, a couple hours to get your nails done, get your hair done, do something to make you feel like yourself, to keep your sanity. It's a really stressful time, and it's okay to take time for yourself.
When is it time to say, something really isn't right, I need to see a doctor now?
Mm-hmm. So if any of those, things that we talked about before start going in the opposite direction, if your moods, are really disrupting your day-to-day life, bleeding's getting worse, really bad headache, anything that doesn't feel like it's going right anymore, that'd be something to reach out about.
Parents already know that when baby comes home, there's likely to be sleepless nights. If you're breastfeeding, that can be very difficult. How do you recommend parents go about preparing for some of those things that do take a toll while still taking care of themselves, like you mentioned?
It's really important to have your partner that's there to help support you. And that partner, can take on different roles. Different people can have a different role to help you get through that. Communication through it is imperative. Both of you or all of you are going to be experiencing it differently. And being able to communicate how you're feeling is important. When you're feeling down, that it's okay and that you're there to support each other. I think being aware that you're not perfect, no one's perfect, and you don't need to try to be absolutely perfect through that period.
And for parents who do choose breastfeeding, that's something to prepare for. It doesn't happen right away. It does take practice, right?
So breastfeeding is one of the hardest things that you'll ever do. I think a lot of people see it as something that's natural, that you should just come naturally to you, but it's really hard. It's painful. You're new to it, or maybe new to it. The baby's new to it, and you're not going to get it on the first try. If you do, that's excellent, but most people, it doesn't come that easily. Working with lactation and having a lactation consultant, a trained lactation consultant at your fingertips on the phone and the classes is really important to help you get through that. Having a breast pump at home already, your insurance pays for one, so having one ready to go and ready to help you, pump if you do have time.
And we often hear about this postpartum period referred to as the fourth trimester. It can be trying, as we've discussed. What's the number one thing you want parents to be, or current parents in that fourth trimester, to know?
I want them to know that it's so important to have your team with each other, your team with your OBGYN. It's important to have an OBGYN that you feel comfortable with, that you feel like you can go to, ask for resources, because you can't go through this on your own. It's difficult. It's exciting. You've been waiting for this time for so long and for 9 months, and you're finally here. But it's a challenge, and each baby's different. Each child's different. And it's so important to have your team feel supported so that you can take care of yourself and have a healthy baby.
Dr. Lippman, thank you so much for being with us.
Thank
and
you.
Thank you everyone for joining us for this important discussion about postpartum healthcare. As always, we encourage everyone in the community to visit smh.com for the latest from Sarasota Memorial.